Hi, this is Jessica DeMassa. I'm in the GuideWell Insights Lounge here at Singularity University's Exponential Medicine 2017. And joining me in the lounge right now, I have Anna Young. She is the CEO and co-founder of Maker Health. So Anna, welcome to the GuideWell Insights Lounge. Tell us a little bit about Maker Health.
Thanks, Jessica. Thrilled to be here. It's been an amazing conference so far.
Fantastic.
So Maker Health was spun out of MIT in 2015, and our mission is to bring prototyping tools to anyone who wants to make medical devices.
Okay.
And empower really a whole community of innovators working at the front lines of care, receiving care, to create the solutions that they want for themselves.
That's fantastic. So tell me a little bit more about this. As we were talking before the interview, you had said specifically that you're focused on doctors and nurses and helping them kind of bring their ideas to life in a hospital. So how are you doing that? Well, we should probably back up. What is a Makerspace for anybody who's not really familiar with that? I know there's a big movement out there, but just in case.
So Makerspace is a prototyping facility.
Okay.
So it is, imagine tools, materials, and anything that you need to make what you want to create. So traditionally it started with like garage makerspaces, right? So that is people having access to tools. But over the past 10 years, what's been amazing is the introduction of tools like 3D printing and laser cutting, which use digital fabrication. So you're no longer crafting everything. You're able to design these custom files and actually upload them, which for healthcare is amazing because you have precision, you have repeatability, and you have a digital file that you can share with an entire community.
Okay.
So our company packaged what actually should go into a clinical makerspace, which is slightly different than your regular maybe school or community makerspace.
So how so? How are you defining a clinical makerspace? Like, where is this going? Is this going into the doctor's office, the hospital? Where is this going?
These are going straight into the hospital, so at the point of care.
Okay,
so
fantastic.
We want it to be right within the workflow of the clinician because they're already busy, they're overworked, and they have ideas when they're in the middle of a shift, not when they get home. They don't want to. They don't have time for that. So we install these directly inside of the hospital, and they have everything from digital fabrication to fluid management, circuits and sensors to cover the entire gamut of health technology.
That's fantastic. And so you're actually bringing this ability to create things and to prototype things right there into the hospital space, and you're looking, like we had said, to doctors and nurses to utilize this lab to develop what?
They are, so they're doctors and nurses, they're closer to the patient than a medical device company, and they're faster than an engineer. So they have these immediate feedback loops with the patient because they're seeing them day in and day out. And so they come in and they're creating, like for example, 3D printing patient data.
What does that mean?
That means you're able to take a DICOM file that's coming from either CT scan or an MRI scan where you're either looking for a particular malignancy or perhaps there's like a bone deficiency or structure. So for example, a neurosurgeon was treating a cranioplasty procedure. So Dr. Desai had this idea. He's like, what if I could actually 3D print that gap in the patient's skull and then cast a mold using hydroperoxidate cement to cover that and fill that and just do all of this in-house inside of the hospital.
That's incredible.
So we were able to facilitate the workflow of taking the patient data from the scan that the hospital is already doing and then translate that into an STL file that can be read by the 3D printer. And Dr. Desai had his part. He was able to kind of work and create this protocol for better patient care and a better outcome aesthetically of the patient post-procedure.
You were just talking about 3D printing, and I do want to ask this because I know it's a two-step manufacturing process with 3D printing, right? To make something, you need to not only 3D print it, but before that you need to create that STL file. So how are you bridging that gap? Because that's not easy. Like typically that's like AutoCAD that does that. And so are these physicians, I mean, how are they able to even like bring their idea to bear in a digital environment? Do you guys provide that service for that?
Absolutely. So that's one of the things that we wrote out. With each of these spaces comes a package of training. So those are bite-sized kind of modules where people can walk through and learn the technology, not needing to get an engineering degree, but really saying like, okay, I'm going to go through these tutorials to kind of take a 15-minute break and start to build these parts. And it's a skill that they build over time. There's certainly a learning curve. But I wasn't trained in engineering. And so I learned how to use all of these tools. And that's what's amazing. And the bigger picture and what we see is that there's now a community of people who are using this. And instead of saying, one of the natural thoughts maybe, okay, let's pair clinicians with engineers. And eventually down the line that makes sense. But really what we want to do is build that prototyping literacy and fill the gaps so that clinicians can be better collaborators with engineers. And that it's not a black box of, this magic technology that somebody knows how it works, but not me. Because when this care team closest to the patient who has all these great ideas, when they understand the tools and how to do it, then they can actually realize their ideas so much faster.
Well, it almost gives them another language with which to communicate what they need. Like now I can just make it and show you a prototype of it, and then we can riff on it and iterate from there.
Absolutely.
Fantastic.
And so even another layer, so collaborating with engineers is one, but collaborating with patients. So what we see is like the same way that patients started coming into clinicians' office with their WebMD data and saying like, I know this is I found it. The same thing is happening with medical devices because access to tools has been democratized.
Sure.
So patients are able to, there's an entire community, Night Scout and OpenAPS, where diabetic patients have been able to modify their CGM to send their data over Bluetooth instead of a little walkie-talkie so they can see to the cloud. And this is like hacking into a regular device that's not modifying or altering how it's used, but creating a way for them to see the data that they want. And then even another layer, like patients are able to, I just had a conversation with a patient who 3D printed his own trachea plug because he wanted to go swimming and couldn't find one on the market. So even it's almost a responsibility of clinicians to start to understand how this technology can be used in healthcare because patients are going to be doing it anyway. And so to have a more dynamic conversation about, well, what do you actually need? And then be able to prescribe it and instead of trying to wait or find. That's really empowering for the whole system and everybody in it.
Without a doubt. It's so fascinating to think of this makerspace in a hospital setting. And there really is a movement going on where people are definitely rolling up their sleeves and putting their ideas down in different ways. Why is this so important to have this in healthcare?
So one of the most amazing things about the maker movement is the ability for people to share what they're learning and doing and know that they may or may not get something out of it, but they have a skill and they want to contribute to that. And so there's so many silos in healthcare right now that being able to take advantage of this open community, open access is incredibly important. And then another layer is just the black boxes of medical device design. And for so many years that has been really the standard of practice is just we're going to get a box and it's going to do amazing things, then we're going to push buttons and not exactly know how it works. Where if you look at the history of how medical devices were made, leading up into the 70s, the people who were using them were also the people making them. That was just how it went and evolved. And we lost that over time, but those ideas didn't go away. So we still have that same workforce and that same passion. And doctors and nurses go into healthcare because they want to be empowered to help patients.
Fantastic, Deanna. Well, thank you so much. This is such an amazing concept, and we're going to start looking for this in hospitals everywhere. I think that's really exciting.
We can't wait. We're having fun growing both in the U.S. and globally, so look forward to it.
Well, good luck to you. It's Maker Health, right?
Yes.
Maker Health, and we're hacking the way medical devices are made.
Hacking the hospital supply closet.
Fantastic.
Absolutely.
Well, thank you so much for joining us. I'm Jessica DeMassa here in the GuideWell Innovation Insights Lounge at Singularity University's Exponential Medicine 2017. Thanks so much.
Thank you.